So anybody ever image anybody with metal in the spine? You think that ever happens? You know, it happens an awful lot. As a matter of fact, as we get older and older, as the population ages, the incidence of implants within the body that not only complicate your imaging procedures, which is what we're going to talk about today, but make it difficult to even get patients on the scanners when it comes to conditional implants with MR. It's quite a challenge. So it's a big deal. We're all imaging a lot more patients with metal. When you have metal in your body, there are artifacts, and these challenge our ability to use our modalities that we depend on for imaging the spine, which is CT and MR. On CT, we're really talking about beam hardening and streak artifacts. On MR, we're really looking at volume magnetic susceptibility artifacts. And I'm going to give you some tips and tricks on how to deal with all of these as we go along. You know that spinal instrumentation is among the most frequently performed procedures and increasing. There's approximately 463,000 spinal fusions in 2014 in the United States, an increase of about 12% compared to 2011. I just had one, by the way. Just about 2 weeks ago, I had a single level spine fusion. Before that, I would have had trouble even walking up to the stage. It was really quite nasty. And you can see things have really increased quite a bit since 1998. There are a lot of complications in post-op setting. This is not what this talk is really all about. This is more about imaging, but you've got to be able to look for things like hematomas and seromas and infection and implant failure and migration and faulty placement and screw loosening. And of course, the incidence of adjacent segment disease. And the adjacent segment disease is an interesting thing because the better they correct the alignment of your spine, the more anatomic and physiologic your spine becomes after instrumentation, the less likely you are to have adjacent segment disease. But if the surgeon doesn't do a great job cleaning you up, you're due to have some problems later on. All right, so getting back to the technical aspects of this. The CT imaging challenges are beam hardening and streak artifacts. You see these dark and white bands on your images, and it's pretty easy to recognize. So what are the most important things that you can do to make a difference here? And the easiest one is the one that's now the least relevant, but I've been giving this talk for a long time, and at one point this piece of advice was particularly important, and frankly it's the slice profile. The thinner the slice acquisition that you're using feeding into your algorithm, the less the artifact will be. It's as simple as that. Now remember, we used to do 5mm spine images, then we used to do 3mm spine images, but now that our spine images are inherently like 0.6 to 0.7 thick, you're going to have the least amount of artifact. And this is actually a 16-channel CT. This was 16 by 0.625. And maybe these images back then when I made this slide was an amazing-looking image. Frankly, it was probably an example of how good things can look. But now you can see with today's technologies and what we're going to see now, you can see those dark bands in between these screws marked by the red arrow, showing you that that those are still the remaining artifacts that we have left behind.